I do want to start off talking about the National Guard testing sites that are at UMOS in both Custer Stadium. They will be open today and tomorrow. The sites will remain open until 7 o'clock tonight, and tomorrow they will be open until 5 o'clock p.m. They will be closed Saturday, July 4th, as well as Sunday, July 5th, in order to observe Independence Day, and will resume back on Monday, July 6th. And so I just want to say thank you to our National Guard for helping us address this critical need for testing, especially during this holiday weekend when we know that more people will definitely be gathering together. And as we talk about this weekend, I know that folks gearing up for July 4th. And so over the last month, I know many people have heard an increase in fireworks being set off in their neighborhoods. So I just want to remind folks that fireworks are illegal in the city of Milwaukee, as well as Milwaukee County. It can be very dangerous as well, not only to yourself, but those around you and the community. And we know that when you think about fireworks, there are many people who may have to go to the hospital related to firework injuries around this time of the month because this is what folks do. And so we want folks to prevent themselves from, getting hurt. So we want to say, don't let off any fireworks because we don't want people really going to the emergency room. We're still in the middle of a pandemic. And so we don't want to fill up any of our emergency rooms. We want to make sure that we're preventing all types of injuries to make sure that we are in a place to have the capacity if anything was to go awry. So please, again, do not set off any fireworks this holiday weekend. And remember that there are no fireworks happening really at all across the county. And so this weekend, I know many people are going to spend a lot of time with their family and friends, and I'm sure everybody's looking forward to it, because I know that I am. And so as we get together, we want to encourage you to please stay outside. We're going to have some good weather, and staying outside can greatly reduce your chances of spreading COVID-19. And so if you're going to stay outside and bring together folks who don't live within your household, we want to encourage you to bring your own food, your own beverages, and not really have a potluck style type of dinner or lunch or barbecue. It's important that we're not passing around the chip bowl and passing around drinks for everybody to sip on because we want to minimize the impact. And so if you are going to be gathering inside, please, I know it's going to be different, but wear a mask if you're going to be with folks that don't necessarily live in your house. It may be different wearing a mask with family and friends, but we need to take all the precautions that we can to make sure that we're protecting ourselves and our loved ones. And with this holiday weekend, we know that many people are going to be traveling as well. And so we want to encourage you that if you are traveling by vehicle to leave a little early. We want to make sure that we are minimizing any types of accidents. Again, we don't want anybody going to the hospital. We want everybody to stay safe. And again, wear your mask when you're out in public. So if you're going to a gas station, if you're going anywhere outside your vehicle, make sure you wear a mask. Make sure you keep some hand sanitizer in your vehicle and continue to maintain that 6 feet distance from other folks. And if you are staying here locally, I want folks to know that they can go to the Milwaukee County Parks website, check out what parks, beaches, and splash pads are going to be open. I want to encourage everybody to utilize our public parks as a way to cool off. But also understanding that we do have some budget shortfalls. So many of these locations will not have lifeguards, and our park maintenance and our cleaning staff is very limited. And so we want you to do your part if you're enjoying our parks and clean up after yourselves, because we want to make sure that we continue to protect our beautiful assets. And I will say that, I know a lot of people have been going to the parks, going to the beach, and I am concerned about the numbers that we are seeing at the beaches. And so there weren't a lot of people necessarily wearing masks or practicing physical distancing, but we need you to. And so if you go to a beach, if you go to a park and you see some overcrowding, we want you to do your part and possibly find another location to go. Consider some different options. We need to keep everybody safe, keep our beaches and our parks safe, and we don't want to see mass crowds gathering at in these public places like we did last weekend. And when we think about the fact that people can utilize our parks and our beaches to cool off, it's extremely important that you are touching base with many folks who are isolated during these times. I hate the term social distancing, so I say physical distancing because we need to be social. And so if you do know anybody who has been at home, making sure that they are safe, please check up on them and make sure to make sure you're lending a helping hand, to be quite honest. And I also want to give a shout out because I know we have some special guests as well, Tiangelo and Francisco, who are leaders in the community, speaking about the importance of protecting yourselves and those around you, because we need to continue to fight this pandemic. And we are seeing an alarming increase in positive cases happening between those between the ages of 18 and 39. And quite frankly, we can't ignore that locally or even at the national level. And I am within that same demographic. I'm 34 years old. And even though I would see myself as being young, vibrant, some would say that, we may feel like we are invincible and that COVID-19 may not impact us. But that is not the case. We need to make sure that we're doing everything that we can to protect one another. So even though you are young or you are healthy, you are not immune to COVID-19. And so we want you to wear a mask. We want people to understand that this is a normal. So I'm really excited to hear from leaders like Tiangelo and Francisco, who are standing up and being role models in the community to show other young people what we need to do in order to keep each other safe. And we need to encourage, again, young folks, not just between that age bracket, but those under the age of 18, to wear masks. And I know it's not cool, but you can go and find a bedazzled mask. You can find you some designer mask. You can find you a superhero mask in order for you to feel invincible at the very least. But we have to continue to normalize these types of behaviors. So let's continue to talk about masks. Let's continue to talk about washing our hands and making sure that we protect one another. That's all I have, and I will kick it off to Mayor Barrett. Thank you.
Thank you, County Executive. And County Executive talked about the sharp increase that we're seeing in positive testing for those between 18 and 39 and referenced himself as being part of that group as well. I'm also part of that group in my dreams, but I am no longer part of that group in real life. So stay young, County Executive. That's my advice for you. Stay young. But
thank you.
He talked about invincibles. He talked about, maybe he didn't talk about, I'll talk about it. Clearly, I think when you're between 18 and 35, you're still Superman or Superwoman, and nothing can go wrong. But what we are seeing is something can go wrong. And not only can something go wrong for you, probably equally important, or maybe more importantly, things can go wrong for your mother or your father, your grandparents, or other people who are older who you run into contact with. So I want to thank Tiangelo and Francisco as well for being part of that age cohort that recognizes that we have to take this seriously regardless of what our age is. And when this first hit back in March, I could see the numbers. The numbers were very, very high for people 60 and above. And actually 50 to 59, I think, was the highest group initially. That was the highest group that we saw the positivity rate for. But as Dr. Weston and others will tell you, now without a question, the highest numbers we are seeing are between people who are 20 and 40 years old. And again, we know that the mortality rate has not been what it is for people who are over 60 or 70 or 80, but there are still serious health concerns. And we don't know what the long-term health ramifications are for this disease as well. So as much as youth is something to be celebrated, there's also some things that are really high stakes here. And so I want to join the county executive and Tiangelo and Francisco trying to urge young people, please, it's not only about yourself, it's about the people you come in contact with. So this is important. And one of the things that we're seeing, and you can see how fluid things are right now. Initially, the decision was that the National Guard would not be testing on the 2nd or 3rd. But the decision was made to include testing on the 2nd and 3rd, which was the right decision because we are seeing an increased demand and we are seeing increased numbers of people who are testing positive for COVID-19. So even though the initial plan was not to have these sites open, the UMO site on 2701 South Chase on the south side and the Custer Obama site at 4300 West Fairmont on the north side, the decision has been made jointly by the state, the county, and the city that these sites would remain open today and tomorrow. So again, if you want to be tested, even if you show no symptoms, you can still be tested at these 2 community sites, and that's very, very important. Unfortunately, and Dr. Weston probably will expound on this, we are seeing an explosion, and I mean an explosion in this nation of people who are testing positive. And it basically took, I think, 2 months before we had 50,000 people who tested positive for COVID-19. I think it took 2 months for 50,000, the number 50,000 to be reached. We hit that number on one day yesterday. Over 50,000 people nationally tested positive. And we are seeing it driven by the western states, by California and Arizona and Texas in the south. We're seeing it in Florida and Alabama. But there is no reason to believe that we are immune from this. And after we saw several weeks of declining numbers, and when I say declining numbers, maybe a better way of saying is that we did not see the growth that we see in other states, we now know that in Wisconsin and in the Milwaukee area, those numbers are growing. And we also know the history of this in the short time it has plagued us is that the first step that comes are the positive findings. The next step that comes are the hospitalizations, and the next step that comes are the deaths. So I am very concerned. And even though we have moved to stage 4, we are monitoring very, very closely what is happening in the city of Milwaukee as well. We are continuing to do our outreach in the city of Milwaukee as well. And we had another webinar dealing with youth serving agencies. We're going to have another one with construction groups as well, so that we can try to get industry experts, health department officials, Medical College of Wisconsin experts to talk about the nuances of each of these areas. We've had almost a half a dozen of these webinars so far. We're going to have more next week. So please look at the City of Milwaukee website for these webinars so that you can be up to speed. But again, my messages are, first, the testing sites will remain open today and tomorrow at the north side and the south side. We're going to continue to do the webinars. But we know that masks and social distancing are incredibly important in all this as well. And so my strong advice and my strong guidance and my strong plea is to please wear these masks when you cannot be socially distanced by more than 6 feet. Wear them if you're going to be in interaction with people. If you're going to restaurants, into bars, into retail establishments, wear the masks. Wear the mask. It's not a political statement. It's a health statement. So with that, I'll turn it over to Dr. Weston. Doctor?
Thank you, Mr. Mayor. Good afternoon. First to our numbers, we have 11,672 confirmed cases of COVID-19 in our community and 355 individuals who died. As we prepare for a hot and sunny holiday weekend, there are several important health considerations. So this is certainly the time of the year where we must be especially aware of our older populations and others with limited mobility. So check on your family members, check on your neighbors. The heat can easily overwhelm these folks. Awareness of heat-related symptoms, including lightheadedness, headache, excessive fatigue, muscle cramps, and certainly confusion is essential. Hydrate well, bring water with you when you travel. That's important as well. From a COVID-19 perspective, you can still have a fun and active holiday weekend while staying safe. So get outside and enjoy the weather, but do so in a way that keeps you and your community safe. With each event, consider people, space, and time. We've talked about it before. People, avoid large gatherings, minimize the number of people with whom you interact closely, ideally just those within your household. Space, being outside is better than inside, and space out from those with whom you don't live. You can still have a great conversation and a good time while keeping 6 feet apart from friends and extended family. And please, as the mayor mentioned, as the county executive mentioned, when you are in public and distancing is difficult, wear a mask. If you go to a farmer's market, you go to the beach, you go to the fireworks, or any sort of a gathering, set an example for being a good member of your community and wear a mask. Finally, time. Minimize the amount of time that you're in close contact with others. Passing briefly, low risk. Sitting together for an hour, much higher risk. To pivot a bit, as has been mentioned, we're seeing a change in the populations affected by COVID-19 in our community. When we go back to March, when the pandemic started to take hold in our state, we saw an average age of infection at 52 years old. In April, that went to 49 years, and then 39 in May, and most recently in June, we're at 36 years old as the average age of confirmed cases. This is a major change. Average age of 52 in March to 36 in June, just 4 months. So to be clear, our youngest death from COVID-19 in Milwaukee County was 23 years old. And there's been several deaths in their 20s. Now, that said, the fact is that younger people are less likely to have severe symptoms from COVID-19. That likely makes them far less inclined to be careful and maintain physical distancing. However, we have to remember that by not doing physical distancing, we're not just putting ourselves at risk, but we're putting those we interact with at risk as well. Our families, our parents, our grandparents, our coworkers, and our neighbors. In summary, we don't live in isolation. We're members of a broader community. Distancing, considering people's space and time, and wearing a mask are ways to be a member of the broader community. Lastly, when we talk about being part of a broader community, it also means that when we consider our local actions, we must be mindful of what's going on around us. We see states stepping back on their opening plans. More regionally, we see Madison backing off on bar activity. Just because our numbers in Milwaukee County are fairly steady, we must be aware of what's going on elsewhere and that it will inevitably reach us. When the houses all around us are on fire, we can't sit calmly in our own house. And make no mistake, much of the country is certainly on fire. We see states throughout the country and counties throughout the state with an overwhelming number of cases. We must allow policymakers and public health officials to be nimble in their decisions to ensure that their citizens remain as safe as possible. Thank you. And I will pass it along to Director Rausch from Greenfield.
Good afternoon, everyone, and thank you, Dr. Weston, and everyone for joining today. I'm Darren Rausch from the City of Greenfield Health Department, and it's my pleasure to provide a quick data overview for Milwaukee County for this week. So we've talked a lot about data so far on today's briefing. Real quickly orienting you all to this slide, you see that and this slide shows cases of COVID in Milwaukee County. We have been fairly steady over the last 3 to 4 weeks. I noted last week that we saw a blip here. It looks like we're coming back down, but again, we can't underscore enough, despite the fact that Milwaukee County's cases may be stable, there are counties around us that are surging in COVID cases right now, and we need to continue to monitor that in the coming weeks and months. So overall, stable in cases. Deaths is a lagging indicator, as has been mentioned previously, and deaths have been largely going down over the last several months, which is, again, very good, but that doesn't necessarily mean that there aren't serious complications and deaths still occurring in and around our community. We've tracked doubling times, and that was mentioned previously. When we look at doubling times in Milwaukee, we can continue to extend that doubling time. Currently in Milwaukee County, we're at about 64 days. If we look just at the city of Milwaukee, we're at around 55 days for doubling time. The state has a different story, though. The state is currently doubling at 33 days. So this shows us that the state as a whole is still having a lot more cases, even though we might be more stable here in Milwaukee County. As we have in previous weeks, we have tracked the reproductive rate, and those graphs are located here. And on the top, we see Milwaukee County, and on the bottom, we see City of Milwaukee. By and large, for the last 2.5 weeks, we have been hovering with a value of around 1.0. That's a notable number because that means for every one person who is infected, they may be transmitting COVID-19 to one other person. We really want to see that number below 1. The trends are pretty similar in both the city and the county, but certainly we want to try to suppress disease. We need to get that number lower throughout our community. There's been a lot of attention today in the media briefing on looking at demographics and looking at where cases are occurring. I have some additional slides I'll show at the end of this report, but the same stories we've been talking about for the last several weeks. Higher cases in the Hispanic subpopulation, higher cases in our younger population, 18 to 39, has been growing pretty significantly for the last 6 or 7 weeks. And these are trends that we're looking at very, very closely. I have said in previous media reports, while the number of cases is highest in the younger age group, the rate of disease has been and continues to be highest in the oldest age group, being 80 years and older. However, when we look at the data this week, the rates among the youngest two age groups, the 18 to 39-year-olds, and the 40 to 59-year-olds is starting to creep up. So the rate amongst 80-year-olds and older is 16.3 COVID-19 cases per 1,000 population. The rates for those two youngest population groups, 18 to 39, and 40 to 59, are appreciably the same at 14.6. So they have really, their rate has certainly increased and is likely to surpass perhaps the rate of the 80+ year population as we look forward in the coming weeks. So we got to continue to monitor that. We are not out of the woods yet. I will show just kind of an active map of cases over the last week. Just to kind of end things, this is what we've been seeing since the beginning of March. There's COVID everywhere in Milwaukee County, but specifically within the last week, historically in the last 3 weeks, I've been pointing to hotspots on the south side of Milwaukee. In yellow, you can definitely see here this week we have more widespread COVID throughout the county, not only the south side, but also the north and northwest sides of Milwaukee, and then several areas in the suburban community that are also having a lot of COVID over the last week. So again, continuing to monitor all of these trends, all of this data is going to be very important moving forward. Lastly, we did develop 2 additional graphs, and this supports some of the data that Dr. Weston and others have described. The first colored map you see here on the screen, very vibrant colors. This is looking at race and ethnicity, and it's looking weekly at the proportion of overall contribution of COVID cases broken out by race and ethnicity. And we can see at the top, here's Milwaukee County as a whole. Bottom left is the city of Milwaukee. And bottom right is the Milwaukee County suburbs. And we can see that in Milwaukee County, we had a large proportion of cases in the African-American population in the early weeks that had kind of leveled off and is now starting to increase. We see, conversely, we had a smaller population contribution among the Hispanic population in the early weeks, and that has grown pretty significant over time. So these are the trends we're monitoring, and we can also see those trends both in the city of Milwaukee and the suburbs below. And then lastly, I'll mention that we can look at a similar, very colorful graphic looking at age ranges. And here the story is very similar to what Dr. Weston was saying. In the early weeks in the county, we had the preponderance of older cases. So reflecting here in the different shades of pink, the 70 to 79 age group and the over 80 age group, they were a large proportion, about 20% of the cases in the early weeks. They've now shrunk to, a handful of percent, maybe 5%. But the growth in the younger age groups, even 0 to 9 and 10 through 17, has largely increased since late April, early May, and has increased to almost a quarter of the population. And we definitely see the 18 to 29-year-olds and the 30 to 39-year-olds increasing pretty significantly over this time frame too. So again, different ways to paint the picture. We see different trends in the city of Milwaukee as we do the suburbs. I'll flag very uniquely that week 5 here in the suburban communities is the week where we tested all of the residents of the House of Correction. So that kind of skewed the data for that particular week. But again, looking at the data, we've seen some pretty significant trends over the last 4 months. Disease is still there. The disease burden is changing amongst our subpopulations. And there's lots of measures that we can and do need to take to keep ourselves safe throughout the community. So with that said, I will end and I'll turn it back to Catherine and we can move on with our briefing. Thank you.
Thank you, Director Rausch, and you teed it up well. So we'll hear first from our guest, Tiangelo. Thank you for joining us today. And you are on mute. There we go.
I am off mute now. Thank you all for having me on today to talk about the pandemic that we're all living through. As a 28-year-old married man, I recognize that this pandemic has halted some real life experiences. I had a musical festival anniversary trip planned, and I had a brotherhood trip out of the country planned. I had to cancel them because we are living in a pandemic where folks are dying. I say that bluntly because that is what we have to think about. Are the safety asks in front of us truly that life altering? Wearing a mask, we know doesn't hurt or damage our lungs, yet we fight wearing them. This is a time to truly be selfless and think of those who are at a greater risk of COVID-19. When we factor that in, the small things we have to postpone or give up are greatly insignificant. Let's be safe over this barbecue holiday weekend. Let's wear our masks and keep our elders and parents safe from harm. Let's also share this message with our peers who are stepping out of the lines of safety. Let's say to our friends, if you go outside frequently without a mask, then we can't see each other in person. Let's make it plain to our friends where we stand. Safety first, and COVID-19 corona will end. If we don't, then we will be in this pandemic longer than what any of us want, and more lives will be lost. Let's stay safe. Thank you.
Awesome. Thank you, Tiangelo. And we'll hear from our final guest, Francisco Sanchez.
Hi, everybody. My name is Francisco Sanchez. I'd just like to start off by letting everybody know that I appreciate the opportunity to talk with all of you today. I'm not saying anything new to state that this pandemic has altered all of our lives. Although we might not have been physically affected by it, the emotional, social, and mental toll that it has taken on us has been clearly evident by a response to everything reopening, right? As more places open, we're quick to jump to the fact that now we can go out again and we're not confined to our homes anymore. The reality is that our response has not been a very positive one as displayed by the numbers. We have to continue to take these precautions. If we do not take these precautions, we're simply going to keep spiking these numbers, affecting all of those around us. And as Tiangelo mentioned, we need to stop thinking selfishly. We have to be a little bit more selfish. We have to start thinking about the ways that we can help prevent this from spreading. As I said, the pandemic is not over. Just because we're tired of COVID does not mean that we do not have to take the safety precautions. Just because we're tired of COVID doesn't mean that it's gone. As the numbers show, it's still very much present. Nobody is saying that our lives needs to come to a halt. What we're saying is that we need to take a couple of steps towards being more preventative and preventing any of that from having to happen again. Please wear your mask. Please respect social distancing recommendations, and please go get tested. Just because you don't feel that you have it does not mean you do not have it. Please be sure that you're getting tested. This is not only about you, it's about all of us. As County Executive David Crowley mentioned, we're not invincible. This might be a minor inconvenience to all of us, wearing a mask, having to sanitize our hands, having to stay away from each other, having to hang out outside might be an inconvenience to some of us, but it's really going a long way in helping us prevent this virus from spreading. I encourage all of you to stay safe. I encourage you to have these conversations with your friends. I encourage you to do the right thing and take as many precautions as you can to prevent from spreading this virus. Whether you're at a cookout with family and friends, whether you're outside enjoying some fresh air at the park or at Bradford Beach, or whether you're out on the streets protesting your right to protest, I encourage all of us to stay safe, to make sure that we're doing what's best for us and for all of those around us. This is not just about us. It's not just about you. It's about Milwaukee. It's about our city. It's about all of those that we can affect. So that being said, I'll give it back to you, Catherine.